Hello, everyone. I have an opportunity to talk about the Indonesia's position or rank in terms of social protection coverage among neighboring countries or middle-income countries. So I would like to share some of my presentation contents that I'm going to present as usual. The International Social Security Minimum Standards have 9 major benefits in its convention number 102, adopted in 1952, and each sections of Convention 102 have higher conventions as listed on the right-hand side. In Indonesia, if I plot the available schemes, it looks like this. For wage workers or employees who have employers, have quite some existing schemes available. Medical care, health insurance is provided by JKN. Unemployment benefit was recently established called JKP. And Jaminan Pension, JP, provides old age benefits, invalidity benefits, survivors benefits. PKH provides family benefit or child benefit. I put JHT, JKM in bracket because from the International Social Security Standards point of view, these were not regarded as Social Security because it doesn't provide periodic benefits. It provides lump sum. And then these are more like saving schemes. The labor law provides sickness benefit, maternity benefit currently, and then pesangon, severance pay, is also provided for the unemployed workers. And these are not Social Security. For non-wage workers, of course, they are not covered by the labor law, so they only have JKN, JKK, PKH. That's it. Jaminan pension, JK, Jaminan pension and JK pays are not provided for non-wage workers or self-employed. In terms of the available schemes in the region, Indonesia doesn't have maternity and sickness benefits in the social security system, while Indonesia has other schemes as listed here. For example, for maternity benefits, only Malaysia and Indonesia do not have such a benefit scheme as part of social security system. So creating these new social security branches will be the next step forward for Indonesia. Triangle means the labor law provides such coverage, but not social security. Cross means we don't have such a benefit schemes. Circle means there are some schemes available. Then the question is the actual coverage or effective coverage. I present as percent of persons receiving such benefits. So in terms of the share of persons that receive at least one social protection benefits, Asia and the Pacific has about 44% of persons receiving cash benefit from social security schemes. So it's more or less around the world average. In terms of the share of children receiving social protection benefits, Indonesia has 27% coverage. I trust this is from mostly PKH beneficiaries. Maternity leave, maternity benefits. We have an indicator called share of mothers with newborn receiving social protection benefits. Indonesia has 28% of mothers with newborns receiving social protection benefits. If Indonesia had maternity benefits, maternity leave cash benefits as part of social security system, this figure may go up. In terms of disability benefits, Indonesia has one of the lowest coverage, that is 2.5% of persons with severe disabilities receiving social protection benefits. That is simply because in Indonesia, the disability benefits are provided through jaminan pension and jaminan JKK, Employment Injury Insurance Scheme, and the PKH beneficiaries have some top-ups for households with persons with disabilities. So the coverage is really limited. If the pension schemes is extended to all citizens in Indonesia, the coverage may be much wider and wider, because the persons with disabilities may be able to receive benefits from the jaminan pension scheme. In addition, such people receiving benefits from jaminan pension may not be eligible to receive benefit because of eligibility criteria, qualifying conditions. For example, if a person with disabilities had disabilities since birth, such persons may need supports from tax-funded schemes. So the coordination between the policy areas need to be reconsidered if Indonesia would like to increase this figure. Unemployment benefits, we don't collect comparative data yet, but as long as I know, the average number of claims every month in Indonesia from JKP is about 30,000 claims, while Indonesia has a 5 to 8 million people out of labor forces, unemployment. So this figure shouldn't be very high, in my view. In terms of work injury insurance schemes, 22.5%, that is the coverage in Indonesia. Again, one of the lowest and may have to be improved. We haven't conducted any detailed assessment on why and how it can be improved, but we could work on that anytime soon next year. In terms of pension, old age benefit, again, Indonesia doesn't have the universal schemes that would allow everyone to participate in the schemes. In fact, TASPEN, ASEBRI, covers 5 million, roughly 5 million participants, and Jaminan Pension covers 13, 14 million only, and we don't consider we don't consider saving schemes such as JHT, Jaminan Haritoa, because it doesn't provide annuity, periodic benefit. So that is not Social Security. So we don't consider it here. So the pension in the International Labor Standards point of view, periodic benefits and will guarantee income security until they die in terms of pension. So extending pension coverage to all citizens in Indonesia will be an urgent matter for Indonesia. Brunei Timor, Thailand have a universal scheme using a tax base. Japan has a mixed scheme, tax funded plus contributory base. Vietnam recently reformed pension system to achieve universal coverage. Singapore has a low coverage, CPF. Malaysia, EPF have low coverage because these countries do not have defined benefit schemes. So they follow JHT, Jaminan Haritoa schemes. So many people are out of coverage. The number of people who are currently contributing to the pension schemes, 16% of labor forces are covered by any kind of pension system, including TASPEN, SABRI, and Jaminan pension. This indicator is very important to think about the long-term strategy, because in Indonesia, there will be 70 million older persons above 60 years old will retire by 2045, while only 16.2% of working age population today are actively contributing to any kind of pension system. So if Indonesia would like to cover them all in 20 years' time, there are only two choices. Start collecting contributions from all working age population today, or paying pension to all citizens from tax base. To do that, Indonesia needs to collect more tax probably, or reallocate tax to pension schemes. But such an actions need to be taken urgently now. Many other countries in the regions have already taken a step and created comprehensive pension system, started creating comprehensive pension system, and it's time for Indonesia to do the same. Thank you very much for listening, and it's a very short presentation, but my role was to set the scene by showing Indonesia's positions among middle-income countries, especially in the Southeast Asia. Thank you very much.